Hello, my friends. I am Katie Taylor. I am a certified child life specialist, and I'm so happy you're joining us on the podcast today. Guys, this is a really exciting episode today because we're doing something we've never done before. Emily, who is a child life specialist that also works here at Child Life on Call, I know her very well. We used to work at a hospital here in Austin together. We have both worked in radiology, and we thought we would come on and talk with you parents or healthcare professionals or child life specialists and talk about a specific procedure. Today, we're going to be talking about what's called an upper GI, and we're going to walk through the best way to prepare, support, and help a child get through an upper GI. This is not a medical podcast and cannot replace the support, advice, suggestions, expertise that you get from talking with your child's provider. We're literally just giving tips and tricks from where we have been in the hospital before in radiology, real time, helping families through this specific procedure. If you have not heard of an upper GI before, according to Kids Health, it is an upper gastrointestinal GI series. It's a test that uses an X-ray machine called a fluoroscope to capture a moving image of a child swallowing and digesting. The test is usually done to help identify symptoms like vomiting, burping, difficulty swallowing, weight loss, bleeding, or stomach pain. It can also help find blockages, ulcers, polyps, pyloric stenosis, and the upper intestinal tract. During the test, the child drinks a liquid contrast called barium to make their digestive system visible on the image. So we are going to walk through literally how to, once you get the orders for an upper GI from your doctor, what parents need to do to help their child get through the exam. So I'm very, very excited. Let's go ahead and jump into this episode. Hello, my friends. Welcome to Child Life on Call. This podcast is a safe place for parents to share their stories about what it's like to have a child that has a medical experience, diagnosis, disease, and or everything in between. We know there's power in sharing stories, and that power multiplies when you can listen to other parents who have walked a similar path to yours. Giving and getting advice is great, but hearing how another parent navigates the complexities and nuances of healthcare is even better. As a child life specialist, my role is to support, validate, and provide emotionally safe spaces for kids and their families, and I am so honored to be on this journey with you. In addition to parent stories, we sprinkle in some expert episodes every now and again that have content for both parents and professionals in the field of healthcare, all with the mission to empower parents to be confident advocates and partners with the care team during healthcare experiences. We're so glad you're here. As a parent, you want to be there for your child, especially when it comes to their health. But healthcare can be overwhelming and confusing. The good news is child life specialists are experts who help families navigate these challenges. But often our support is only in hospitals. So imagine if you had access to these valuable tools and resources all the time. You would be able to understand medical procedures, explain them to your child, and help them feel less anxious, which also makes you probably feel less anxious. So when your child visits the doctor, has surgery, or has a medical procedure, having the right information and support can make all the difference. You, the parent, can be prepared to answer their questions, calm their fears, and advocate for their needs. Child Life Specialist tools are ready to be in your hands right now through our app Support Spot. All you have to do is go to the iOS or Android store, type in Support Spot. We are giving all of our listeners on this podcast access to the app for just $19.99 for an entire year. You are going to have, I'm not kidding, 7 years worth of resources and support and information that we have been building at Child Life on Call at your fingertips. With these tools in your pocket, you can transform the way your family experiences medical care. Parents, you deserve to be informed and feel confident in your child's healthcare journey. And by having access to Support Spot, you can ensure that your child feels supported and understood no matter what medical challenges come your way. Head to the link in the show notes or go to your app store, type in Support Spot to download it today. Hi, Emily.
Hi, Katie.
Why don't you, first and foremost, welcome everybody to this first version of this podcast, which is Emily and myself chatting about a specific procedure and tips and tools and strategies that we have seen in our decade of experience as child life specialists. But yeah, hi all, I'm Katie and you know me, but Emily, you want to introduce yourself?
Hi, all. I'm Emily. I am the other half of the Giggly Squad, but Child Lifestyle. I am a child life specialist and also work for Child Life on Call. So happy to be here and excited. I loved radiology. My last job was actually working in a GI clinic, and we did a ton of
Mm.
these. So and I love GIs. I think there's like a special place in heaven for a pediatric GI. So
Oh, no
they're
doubt.
they're fantastic. They're the best physicians, I think.
I feel like they, without realizing it, got into a job that was going to be both physical and emotional support.
Yep. They are the biggest advocates for child life because they know that the mind and the body are connected and they
Yeah.
see it daily in their clinic, right?
Yeah.
And so they believe in it and they understand it and they want to improve these kiddos' lives.
They've got their brain and they've got their gut brain, and
Yep.
they understand that with
Yep.
families.
ab-
So, this is not a medical podcast. Don't take anything we say for really anything. This is we're purely here for your entertainment. And if you happen to be a parent and your child needs this procedure we're chatting about today, hopefully some of this information will be helpful. I know it will be, because if you're going from not knowing anything, you will leave today with feeling like you're equipped to handle the procedure, which is an upper GI.
G to the I. And going off of that too, so much of an upper GI can like spill into other GI type sort of x-rays and scans because they get a little confusing depending on where the doctor is looking. So even if you might hear upper GI or barium swallow or swallow study or different things like that, they
Yeah,
all of these sort of coping techniques and tips and tricks can really be used for a lot of these.
for sure. So, swallow study typically, well, there's a speech therapist or a speech language pathologist there with you. That's not what we're chatting about right now, because I think when you've got an SLP in the room, child life can be helpful and sometimes, but I didn't do a lot of those. So, I'm not speaking from that experience. Emily, I don't
And
know if you've done
and
that.
SLPs are like, I mean, again, God's gift to
Yeah,
creation, right?
I know. I know.
They know how to, include parent in the study. They're really good at bedside. So yeah,
Yeah, yeah,
you're
yeah,
right.
yeah. So gosh, we both worked in radiology. I did my internship. One of my rotations was in radiology. To my practicum, I guess I'm just a big radiology fan. And then I worked in radiology for years at a hospital here in Austin.
Where
And
we
so
met,
where we met,
where we
which
met.
is where we fell in love.
Yep.
So, parents, an upper GI, and this is just a strictly like child life explanation of what this is your doctor may write for your child to go get an upper GI. And what this means is you're going to need to go to a clinic or a hospital that has something called fluoroscopy, which is basically like a video x ray. So, it's not just taking a picture, it's taking a video of it all.
Kind of like a segmented, yep. Bam,
Yeah.
bam, bam. Hmm.
Cereal images, and they're,
Hmm.
like, getting to see it. Not cereal that you eat, like cereal, like, a lot happening in a row.
Like the
But
podcast, serial, like the
yeah,
podcast. Yeah.
yeah, and spoiler alert, in some cases, you do eat in the upper GI. Okay, anyway, so we're talking about parents bringing your kid to the upper GI procedure. Emily, what do you think is the first thing parents need to do to get prepared once the doctor has written, like, "I'm gonna write you for an upper GI so we can see what's going on."
Yeah, that's a great question. I think getting it scheduled around your kiddos' eating time, feeding time,
Yeah.
because we would run into this a lot. Sometimes, and it depends on the physician, and again, this is not going to be medical advice. Sometimes you do have to fast before, depending on how empty they want your stomach. So sometimes we'd have these babies, that they haven't had their first feed of the day. So
Right.
you can schedule it around your baby or your child's schedule, depending on what works best for them, right? If it's feeding time, let's do it then. There's more
Yeah.
enticement, right? So I think looking for that, looking for the scheduling, making sure that where and when you're scheduling it, they do have child life available, right? Sometimes they might say, oh, well, our first available is in this clinic, across the river. And you're like, "Do they work with peds there at that clinic
Yeah.
across the river?"
Oh, yeah. Good
You know?
question.
So you wanna make sure that it's done at a pediatric facility with trained professionals that are used to working with pediatrics.
Yep.
And then, once you kinda have those 2 things down, I think it's as far as you it's looking at your preparation piece with your kiddo. And so that's using all of those resources and all of that support, whether that be our plug, our app, or any other sort of resource support. You want to make sure that you are ready to be able to prepare not only yourself, but your kiddo. And I'll let you kind of go into that a little bit.
Oh, yeah. Let's pause on those things. So Emily had great advice. Schedule it around feeding times. Remember that you can advocate for it to be at a pediatric facility. You can shop around for that and just make sure that they're willing to give the images to your physician. And when not to schedule it, nap time.
Oh, that's a good, yeah, yep.
Do not
Awesome.
schedule this at nap time because you need full cooperation of your child during this. And if they are cranky pants, it's not going to be fun. Mm. Okay, so that was really because I wasn't going to say that, and you reminded me to say that because you're so smart.
Oh, yeah,
Okay,
it's
so
all
you
those, yeah, those little the scheduling thing, I think so many times, and me as a parent too, I'm like, whatever's best for the radiology
when can you
people."
fit me in?
These people work from 8 to 5, right? So
Yeah,
so whenever is best for you is best for
yeah,
them, because
yeah.
then they know that we're all kinda set up for success.
For sure. I think that's great. And if you can get reinforcements, like it's you and your partner or you and someone, like bring the people. We also know that sometimes you'll have to bring other kids with you because obviously like people have multiple kids. If you can get a friend to watch that other kid or it's at a time where they can get a daycare or you can get a babysitter so you can solely concentrate on the child who needs the procedure because they're going to need your full support. But if you can't, we've got tips for that too.
We've got tips for that. Oh, and then I was thinking, just they usually do not allow a pregnant caregiver to be in the room.
Yes.
So, if you are pregnant, just making sure, like Katie's saying, bringing in that extra support person that can be with you so they can provide support at the bedside.
These are all questions to ask when you call to schedule. Like,
Mhm.
I'm pregnant. Some people will allow you to be in there if you agree to sign a form and you have to wear a lead apron on you. Some won't let you in at all. Some will let you in for a little bit, maybe not while they're taking the images. So these are all things you want to know ahead of time. And if you are pregnant and they say that you can't be there, advocating for a child life specialist and doing it at a pediatric facility is highly recommended. Did you know we were going to talk so much about scheduling? There's even so much just
I
there to
I
think
think that's
about.
like one of the most important pieces, right? Like,
Yeah.
I've learned just by being a mom too, the scheduling thing is
Yeah.
key.
Yeah. So, okay, you've got it scheduled. You're going to a pediatric facility. Hopefully, it's scheduled at a time that works for you. You've decided that you can or can't be in the room and all of that. And so, there's a lot of discussion about when the proper time to prepare your child for something like this is. And we're always just going to go back to you know your child best. We can give you some I'm not even gonna call them guidelines, but just suggestions about when to think about preparing, and we'll do it by age. For me, I think it's a great like, let's start with toddlers. For toddlers, the most important thing you can do is prepare yourself first. So, like Emily said, download the Support Spot app, scroll down to the procedure section, click upper GI. We walk you through what is the test, why does your child need the test, and what I think is the best part, the sequence of events. So we will literally talk you through
Break it
like
down.
1, 2, 3, 4, 5, 6, 7, 8. These are all of the steps of the exam. Preparing yourself before you're preparing your child is what I would say to that. And then Emily, you can follow up on like the actual
When
words to use with your toddler or when to do it.
Yeah, and that's the best question, I get from friends, like, when their kiddo has an upcoming procedure or a surgery, and they're like, "When do I tell them?" For toddlers, really, that I think that morning of is usually fine,
Yeah,
you know?
agreed.
They don't need to go to bed at night thinking about it. They're not there yet mentally, and
Yeah.
emotionally. So, you know how when you have those questions of the day when you're at breakfast and they're like, "What are we doing today, mama? What's our plan?"
Yeah.
I think that's the best time to do it for a little one. And for toddler age, keeping it very, very concrete and
Mhm.
very simple,
Yeah.
right? Here is our steps. We're going to this place. This is the doctor's office. We're going to this room where the doctor is going to ask you to drink some white liquid while they take your picture. And then after this, where would you like to go? Or what would you like to do? Very simple, very concrete, keeping it in like 2 to 3 to max 4 kind of steps, right?
Yeah.
For that toddler age. And again, using concrete language, you're going to get the questions too about like, oh, I don't want to drink that. What does that taste like?
Yeah.
Um, the way that barium has always been described to me by kiddos is it's just chalky. It's a little
Yeah.
bit chalky. Some doctors, some of my GIs called it like a marshmallow drink, and that's actually a really
Yeah, that
it's a good
actually is.
yeah, because it looks like a consistency of a marshmallow,
Yeah.
um, but it doesn't taste like a marshmallow.
Yeah, unfortunately.
But the great thing is some of these pediatric offices offer flavoring for it.
Yeah.
Um, so again, Katie, when we're talking about those steps prior to day of, when we're going to that scheduling department, that's a great question to ask. Do you
What
guys
can I
have
mix?
any flavoring that we can mix with the barium? And they'll
Right.
be able to give you that information so then you can prepare your kiddo. But
Yeah.
it's really just that chalky kind of consistency and like a marshmallow drink. And and do you agree on the toddler sort of preparation? I know we kind of go back and forth on like when to do
Yeah.
it.
I think I agree. I think a morning of a toddler thing, I think I think that's appropriate. It also depends on what your morning's gonna look like. If you
Yeah.
have 7 kids to get out the door in the morning and you're like, sure, you could talk about it the day before, and I would say it as like, "Tomorrow, we're gonna go see the doctor, that they're gonna take special pictures of your belly," and, like, I would leave it at that, and
Yeah,
you get
we
a
don't maybe
special
need to
drink.
go into the chalky
Yeah,
stuff maybe till
yeah.
the day of,
Yeah,
but
yeah. Yeah, don't especially with toddlers, I don't think you need to talk about consistency. What I would not do is say that it's gonna be you're gonna get to drink your milk,
yeah.
because that is not true, and they will fight you when they're like, "This ain't my milk, give me my milk," and so I would just not do that.
Yep.
I would just say, "There's gonna be a special drink, we're gonna take pictures of your belly. Mommy's gonna stay with you the whole time."
Mhm. Yep.
Yeah. Going into preschool, I think you could get away with doing it the day before,
Mhm.
especially with some of those older 3s, 4s,
Yes.
5s.
Like
And I
before.
love the pack a bag thing the night before.
Mhm. Yep.
Yeah,
Yeah. Again, those simple concrete steps. What would you like to take with us when we go?
right.
What do you think would be helpful for you when we get there? If we brought your favorite lovey or we brought that special cup and we could ask to see if we could use it for when you have to take the pictures. Yeah, some simple things that they can pack with them that they could have in a little backpack, I think would be a great it gives them something to do and it gives them a little bit of control on
For
what
sure.
they can do, what they can pack, and we for that age, control is so important, right? With so much of that no, 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 this gives them back a little bit of it.
And it might save you in the waiting room.
Right.
Like, if they have a bag full of things to do, and it's something that they brought and they're in charge of and they're holding that bag. And don't sleep on what Emily just said about bringing your preschooler's favorite cup. I
Mhm.
just prepared a friend of mine, kind of like a colleague. Her 3-year-old was going to get an upper GI, and she said, like, the cup is what saved them. They actually, like, went and bought a special cup just for this special liquid that she was gonna have to drink for the pictures, and she said she was so excited for this cup that, like, we can talk a little bit more, but, like, it changed the whole game. It made it a
Mhm.
breeze of a procedure. So,
Yep.
a special cup, special straw.
Special straw. Yep.
Yeah, yeah.
And
So
and
yeah,
if you can have that, if in those pre-op sort of questions, pre-procedure questions, if they said you can, sometimes they're like, oh, we can actually do like chocolate syrup or something like that.
yeah, yeah.
So again, if they can have that sort of choice, then say, "Would you like a chocolate syrup? Should we pack it in our bag?"
Right.
Little things like that. And again, it just depends on your facility, but sometimes these things are an option depending on the team.
As we're kind of in the whole like choice conversation, I think one of the things that's really important to set boundaries at first is like you're going to have a lot of choices today, like what you can bring, like what we can mix into the liquid. It's not a choice to take these pictures. We
Yeah.
have to take these pictures so the doctor can see how you swallow in your belly. And that's more getting into like we're kind of moving into the school age conversation about how to prepare. So, school agers will need a little bit more context, likely, want to know what's happening.
Yeah, less
And
of that 3-step sort of, it's gonna be a little bit more detailed.
yeah. And at each step, you can normalize that process. So we're going to head to a new doctor's office. You haven't ever been there before, but we'll probably have to check in. You know how to do that. You know how like we check in when we go to the doctor's office and they ask you for your name and your birthday, and you're saying all these things out loud. It may be like, of course, to you that you know that's going to happen, but just saying it out loud and showing your child like we've done this before. We've gone into an office, we've said your name, we've done all that. Like that will put them at ease because they know they've mastered that. We'll be right back. Finding a solution to support and ease your child's daily bowel movements and improve everyday health can feel like a challenge. 30% of children struggle with constipation, and it can feel impossible trying to find a solution for your child. Especially if your child has food allergies or has a condition or illness, you want to feel good about the products you're selecting for your child. To me, finding a company whose products have the highest quality and natural ingredients is really important. Begin Health's flagship product, Growing Up Prebiotics, is a tasteless, textureless, fine powder that easily mixes into water, juice, or smoothies. This makes it convenient for daily use without altering the flavor of your child's favorite beverages. You might ask yourself, what exactly does a prebiotic do? In the simplest of terms, the gut microbiome, aka bacteria, viruses, and fungi, are living organisms that are inside our intestines and on our skin. Begin Prebiotics feed these living organisms with the unique blend of human milk, oligosaccharides, HMOs, and fiber from chicory root inulin. Research has shown that the gut microbiome plays a significant role in the development of the immune system, digestion, and production of some vitamins and proteins. And get this, Begin Health's mission extends beyond nutrition, offering comprehensive resources for caregivers, including parent support groups and tools to create fun and engaging ways to get your kiddo to have smooth poos. To learn more about Begin Health's product, visit their website at beginhealth.com. And again, that's www.beginhealth.com. The growing little gut is the command center of early health, and here at Child Life On Call, we're helping to spread the word of investing in gut health positive routines starting at the earliest of ages. Child Life On Call podcast listeners get 25% off selected products, and you're definitely going to want to get the Poop Tracker game cards and stickers. You know, Child Life specialists love a good sticker. This applies to your first subscription order and one-time orders and limited to one use per customer. Head to beginhealth.com/childlifeoncall and use code childlifeoncall to get 25% off.
Mhm.
Yeah.
Absolutely. I think in that familiarity, right? This is that place we've been to before. Remember, it's the same sort of check-in desk. Remember that mom stayed with you for that last doctor's office visit. This is the same thing. It's just in a
Yeah.
different area.
Right.
And so yes, that familiarity for those kiddos is huge. I know for my 8-year-old, he's always like, "Are we going to the 5th floor?" And he knows the 5th
Yeah.
floor is the doctor's office. If we're going to the
Right.
1st floor, then that's the X-ray place. And so
Right.
yeah, today we're going to the 1st floor for some to the X-ray place. And so yeah, that sort of familiarity and continuity for them is really important.
And even if you haven't been there before, they've gone through a similar process
So
before. And like you've got your bag of stuff that you've got with you. You know, I'm going to stay with you the whole time. I actually don't know what the place looks like that we're going to. I haven't seen it before, but you and I will find out together, is
yeah.
a perfectly acceptable
We
answer.
will figure it out together and make sure that your questions are answered along the way too.
Yeah.
That even though you may not have questions right now for mom or dad or grandma, we're going to be able to answer those with you because we're going to be there with you the whole time anyway.
Yeah, exactly. You could also start talking about the people that they're going to meet. So depending on the age and what's appropriate, what your child's asking, you can talk about how there's gonna be somebody there called, and I don't expect you to know this word, but like a fluoroscopy tech or an x-ray tech, and their job is to take the pictures. And sometimes the doctor is there and they're called a radiologist and they help watch the pictures while they're taken. Now it differs from place to place. Some will actually have the radiologist in the room doing the exam. Some are in an offsite location in a dark room and the pictures then get
Just the
sent.
way they like it.
It's just the way they like it in those dark rooms. And that's not really, this is TMI. You probably don't need to know all of this. It doesn't make or break your exam in any way, but just so you have a heads up about who you're going to meet.
Oh, absolutely.
Emily, in your experience, are they, I've seen it done both ways where the child has to change into a gown.
Mhm. Yes, sometimes the gown, yes, is like the biggest, stressor, right?
Right.
So, when I've been present for them and I can tell that the kiddo is feeling nervous about putting on the gown, we just talk about that the reason why we put on the gown is so the barium does not spill on
Yeah.
you and mess up your pretty outfit. Sometimes the parents are like, "He doesn't care. We're gonna keep the shirt on."
Yeah.
And so, as long from what I have been a part of, as long as there's no metal in it, you should be okay.
Yeah.
But most facilities want you to wear the barium because it is kind of like a foreign substance and they just don't want it to get on your clothes. But that's really the main reason why. Some kiddos just do without either. They don't have a top on and they don't have a gown on either. They just go commando.
Yeah. Yeah. Commando. I love it. Yeah, that's a good point to think about is what they're gonna wear, and preparing your child is just like a plain t-shirt and sweatpants is gonna be probably the best way
You're
to do
right.
it.
Right. And that's
Best
what I've told
leggings.
told parents before. If you can just wear like your softy jammies that day, it's
Yeah,
probably best.
great.
Yeah.
And if you do have to change into a gown, sometimes they don't like the word gown, you could try hospital pajamas. You could show that everybody who works there is actually in hospital pajamas called scrubs, and that might help the situation a little bit more. So you get in there, you get changed or maybe not get changed. Depending on how the test is ordered, sometimes they will have your child, I saw it sometimes where they had to do the stand-up thing. You have
Mhm.
to put something in your mouth. This, I saw this mostly with older kids. I don't know the name of it, but they told me it's a lot like Pop Rocks, and they take a picture. Do you remember that?
I don't know if I've ever done this one.
Okay, then it may have just been a particular place, but they would go
Okay.
and they would have to put something, but then the bed will go flat.
Mhm.
And this is where the support spot comes in really good because we'll have pictures of what the bed looks like. And you're like, that's not a bed, that's a table. But you can call it a bed, you can call it a table. And then above it is this like big camera that looks like it's got like a big swirly tube that goes and connects it to the ceiling. And
Mhm.
so showing your child a picture of that ahead of time is going to help you because you're going to say your job is to go in, you'll lay down on the bed, and you'll see the camera will be right above you.
Yep, right above you, not on you, right? Not touching you, but right above you. And
Hmm.
then again, yeah, using the app kind of as a guide because you can even see on the pictures that we have kind of where, okay, where's my game plan of where I want to stand and support.
Right. Yeah.
So, because you might have the text on, this side, on one side. So you're thinking, oh, maybe me as caregiver can be on this side, kind of up at the head. So yeah, using those picture visuals is always really helpful beforehand to kind of figure out your game plan.
Absolutely. So the child will be laying down. They will have to drink while laying down, which can feel weird at first. And so maybe for an older kiddo, you could even practice that at home first, like drink a sip of water out of a straw while you're laying down. And then the way we always prepared kids was for doing a little bit of a log roll. So you'll lay on your back, you'll roll to your right side or roll to your left side. And if you can imagine, parents, it's literally watching the barium coat the
Mhm.
belly so that when they're taking pictures, they're seeing where the barium goes and does it go back up and where does it go in the body.
Yep, and that's exactly right. It doesn't, and those positions might feel a little funny for your kiddo, like going to the side, going to the side, but whatever sort of, and we can talk about this too, as far as like distraction techniques and coping techniques for the actual rolling. you can kind of engage them on both sides as you're doing the rolling to kind of keep you can move from side to side as the caregiver too if you want to keep
Yeah.
providing support on each side.
And as long as your hand isn't underneath the camera, like you can hold your kids' hands and then the tech will be really good about telling you where to stand and how to be there and hold your child. But I often think like just a hand on a shoulder, like that reassurance from parent is really good. What are your tips on taking actual sips of the barium?
I know, I was trying to rack my brain because actually, like, some of our techs had some really good sort of ideas, since they had, this is what they were doing every day and kind of what worked well. You don't wanna do a lot of the bribing, right? Because they have to drink. That's not really the choice, right? So those sort of like, if you drink, XYZ, you really wanna say, "If you can take 4 sips of this, then you look at the tech and like, can we have a break after that?" And she'll usually be like, "Yeah, we can take pictures after X amount of sips," right? So let's get those sips down. Would you like to sing a song? Would you like mama or daddy to, count to 20 with you? Would you like me to plug your nose while you drink? Would you like to use that straw that we just brought or that special cup? Those simple sort of choices that are available to them, but not the, if you drink kind of thing.
I think that's great. And I would go into it almost acting like you're going to be able to do this no problem.
Yeah.
Yeah, you know how to drink, you know how to take sips.
Mhm.
And it's not until you see your child really struggling to drink that I would even bring up because the drinking is not the choice. But just like Emily said, okay, how about we do this? How about we take 4 really big sips and the tech has to tell us that these are good, and if they're good, we can take a quick break, and I think
Yeah.
that's perfect.
Yeah, and the nose holding I have seen. Yeah, and like you're saying, you don't wanna, like, bring up nose holding, like, right away, right? Because 'Cause they're like, "What is
Right.
that?" But this
Yeah.
is if we're having struggles. But yeah, you're so right, like, starting it off with, "Well, you know exactly what to do. You drink just like this at home. I know I've seen you take big sips of your drinks at home. This is a special drink that is gonna help your pictures light up on the screen. Do you wanna see them light up?" Right? And then
Mhm.
sometimes the text can just, like, show you the screen as you're
Right.
drinking, and
Yeah.
they're like, "Oh, look, there's your liquid going right through." And some kiddos think that's really cool to see. So I love that, Katie, kinda starting it off with really positive, and, hopefully that can bring some of their, positivity to getting it done and feeling really successful about it.
Right. Yeah, I just saw that, like, "Look at you, you're doing it." And like Emily said, I've seen kids too, like, it's almost like a game. As
Mhm.
soon as you drink it, you can watch it. It's white in the cup, but on the screen it looks black, and so it's fun for kids to
Just
watch
be able to see.
and look at. Yeah. And then probably the biggest thing is just staying calm as a parent
Mhm.
and just, planning, preparing for things not going well and having some tricks up your sleeve, but knowing that this could go really well. I've seen it go great with 2-year-olds, 3-year-olds, every age. And it just kind of, I think all of these tools and tips we've given you could lead you to a really successful experience.
Oh, absolutely. This test really does usually go pretty well. Usually does not last long. We're not talking like this is not like an hour thing.
No.
They really don't wanna do a lot of imaging on little ones, right? So they're really trying to get a lot of times the tech might even step out for a second to check with the radiologist to see, "Okay, we were able to get, X amount of sips down. Can you see if that's good enough?"
Yeah.
So you want those techs on your side. Usually they're really, really receptive and they want the best pictures possible, and they wanna do it in the least amount of time too. So they're
Yeah.
really on your team, and so
Yeah.
working with them to, really make it successful. But yeah, most kids do really well with this, and like you're saying, if you as the parent are calm about it and knowing. I always think about too, like, a little self-care for me after these things, right?
Uh-huh.
So
Oh, yeah.
yeah, so, like, if that means we get this done and your kiddo goes back to daycare and you go take a little lunch before you go back to work,
A
little
100%.
self-care things for you. I tell parents that all the time because that
Oh,
is going to kind of get you through that stressor.
Emily, you know what I would do, and this is, I don't think this is the right thing. I don't, not right or wrong, but like if I had to get my child out for a test and we had to go do it at 11, I'd be like, I don't want to send them back to school. I feel bad. They had to go through this. But guess what? I've already used a lot of my patience that day. There's not a ton left.
And you've gone through it too.
And
Yeah.
I went through it too. So actually sending them back to school, a place where they're safe, they have their friends,
They're
and
going
you
to take
get
a
made
nap.
they're gonna take a nap, or maybe you get like 1 more hour to yourself to like go get a coffee.
Mhm,
That's actually the best piece of advice we've given you, is
mhm.
what Emily just told you.
Oh,
Yeah.
yeah, no, I mean, I'd have to do it as a parent, and, my friends laugh. They're like, "But you're a child life specialist. This should all should be really easy for you." This
No.
is not really easy for us,
Yeah,
right?
no. No, totally.
And I think a lot of times as our caregiver, it's like everything's kind of bottled up and we're keeping ourselves really, like
Mm,
compartmentalized for our kiddos. And then after you can like
yes, that's
take a
it.
beat.
Well, you're the best, Emily. Are there any other things that we missed today?
No, I think at the end, a lot of parents, are want to know, like, did you see anything? When will we hear the results? The techs really have to be able to send those results back to the doctors to be read. So even if you have a radiologist in there with you, he or she might say, I still have to go and read these. We'll have to get them back to your provider before the results come back to you. So that doesn't mean anything bad. They just want to do their due diligence and get everything processed and read and then sent to your provider. And then I would expect, give a couple days. Sometimes these results can take a little longer just because they have to go to the physician, they have to read them, then they have to get the results back to you. But definitely follow up with your care team if you're not like hearing back within a week or so.
Yeah. I've also heard techs say that it's normal for poop to look a little white after drinking the
Oh, that's
barium. Have you
right.
heard that?
Yes, that
So
is right.
if
They'll have white poop.
yeah. Don't trust us on this. I haven't seen the white poop, but I've heard them say that. So it's always good to just hear these things a couple times because there's a lot you're having to navigate when you into these situations. Like Emily said, in some cases they get sent. In some cases, I've seen the radiologist go, "Nope, everything looks great. I'll make sure your provider knows everything looks great." It just depends on
Yeah.
probably what they have going on, who's in the room, what they feel comfortable saying, and all that. But this was
Yeah.
fun. Let's do it. What should our next procedure be?
Oh gosh, I was thinking of that. I was thinking of VCUGs the whole time we were talking because that's like a
Oh,
whole different ball game.
yeah,
And I would love to do that because it's kind of it's long, it's invasive. So,
yeah, yeah.
definitely
Let's
thinking
do
about that.
VCUG next.
Yeah, but I think we'd love to hear whatever you guys want, what are our parents wanting to hear more of, and we'd be happy to break it down in a fun giggly squad-esque type way.
Sounds great. For those of you who don't know, Giggly Squad is a podcast that we love and listen to, and it makes us giggle the whole freaking time. So,
Yeah.
yeah, ask us your questions, give us your feedback on this episode and what you want to hear more of. And thanks for joining us today.
Thanks,
I
guys.
am.
Bye, Katie.
This episode of the podcast is in memory of Dr. Meredith Hitch. A true helper, Dr. Hitch loved her patients fiercely and believed in the beauty of family centered care. She was often found cracking a joke about bowels, dressing up as a whoopee cushion for patients, and making the most stressful of days for families a better experience. She believed in the power of child life and always advocated for emotionally safe care of her patients. We will miss her dearly and will continue to carry her legacy of serving, loving, and caring. You guys, I have the best news. If you didn't hear it at the beginning of the episode, Support Spot, our app, is now available for every parent. You no longer need a hospital code to log in. So go ahead, go to childlifeoncall.com/supportspot. So go ahead and go to childlifeoncall.com/supportspot and download our app today. Hospitals and child life specialists, yes, we are still partnering with you if you want to customize content or provide this app to your families free of charge. We're so grateful that you're here. When you rate and review this podcast, it helps other families be able to find us. So let's keep doing that, and I will see you again here next week.